Welcome, everyone. Thanks for joining. This is Ask the Expert with Dr. Turkeltaub, all about the role of neurologists in aphasia care. I'm going to be your host. My name is Jen. I'm part of the team at the National Aphasia Association, a nonprofit organization dedicated to advocating for people with aphasia and their families. I've got our panelist, Dr. Peter Turkeltaub, today with us, who I will be introducing shortly. We are so happy that you've joined us for this 1-hour session. So over the past few weeks, we've been collecting questions from our audience, but if you have any questions during today's session, please feel free to enter them into the chat. We will try our best to answer some of the most commonly asked questions. Hi, James. Hi, Kitty. Hi, everyone. So now I am so happy to introduce Dr. Peter E. Turkeltaub. I'm going to have to take a deep breath for this one to do his bio. Dr. Turkeltaub is a cognitive neurologist and neuroscientist. He is the director of the Aphasia Clinic at MedStar National Rehabilitation Hospital, an associate professor of neurology and rehabilitation medicine at Georgetown University Medical Center, where he directs the Cognitive Recovery Lab. He has published numerous articles for high-profile journals, has made outstanding contributions to the world of neuroimaging, and in 2017 was recognized with one of the most prestigious awards in the field, the Norman Geschwind Prize in Behavioral Neurology by the American Academy of Neurology. Dr. Turkeltaub, thank you so much for joining us.
Thanks for having me. It's great to be here. I wish I could see you all. I've been saying that to everyone who I talk about this. I wish I could see your faces, but it's nice that I can see your names. So it's nice to see everyone.
Let's jump into our first question, which is the main topic of today's webinar. Dr. Turkeltaub, what is the role of a neurologist in aphasia care?
Yeah, well, it's a big question, I guess. So I gave that as the sort of topic for this first Ask the Expert, because I am a neurologist and I thought, well, what can I talk about? I can talk about what I can do for people with aphasia. So I think one of the things we may see in the questions is a lot of people know there are lots of different kinds of doctors who are involved in care for a person with aphasia. And sometimes it's confusing sort of what the role of the different doctors are. And so that's why I wanted to talk about this a little bit. So the neurologist's role, the primary role, is in understanding what the biological problem in the brain is that's causing the aphasia. So it's diagnosing the brain problem that's leading to the aphasia. And so that's going to involve things like MRIs, depending on the type of problem. It might be lumbar punctures or other kinds of tests. Hopefully, your neurologist helps you understand the problem, so they can help you understand why you're having aphasia or other problems like aphasia. And then they can develop a treatment plan. Now, the treatment that neurologists have available to them mostly are going to be brain treatments. So they're going to be things like medicines. They sometimes will recommend surgeries depending on the problem. And they'll recommend things like therapy, of course. But I think one thing that's important to know about most neurologists is that most neurologists are not really trained in rehabilitation. So I think I've found many people with aphasia who are frustrated because the neurologist first sometimes doesn't understand what the problems that people with aphasia face over the long term. And I'm speaking here really about people who have a stroke or a brain injury, those sorts of problems. So a lot of neurologists won't have a lot of experience caring for those people over the long term because they don't have training in rehabilitation. So the rehabilitation sometimes is the role of a different doctor, the physical medicine doctor, or sometimes you see these people called physiatrists. Maybe I'm gonna try this thing with the whiteboard. So I'm gonna pull up a whiteboard so I can type a little bit. Physical medicine or physiatrist. So these are the guys. So these are the guys whose training is about rehabilitation, and they can address things like spasticity, and will know a lot more about the course of recovery than some neurologists do. So I think I wanted to address that first because I know that's a frustration for some people. But if you're dealing with a good neurologist, what a neurologist can offer in the long term is understanding the problem that you have, recommendations for treatment sometimes, and the neurologist can help deal with what we call comorbidities. So these are other problems that people with aphasia often have. And so these are things like sleep apnea, which is a very common problem, especially after stroke, or depression, or seizures, these kinds of things. And then if you're dealing with a neurologist like me who has expertise in aphasia, we can sometimes make extra recommendations like medicines that can help with memory or word finding or research studies. Okay, I should probably stop talking so we can get on to the next question because I know we have a lot of questions.
What is the difference between a neurologist and a neuropsychologist?
Okay, so a neurologist is a medical doctor. So the focus here is diagnosing brain problems and medicines, so medical treatments. That's a neurologist. The neuropsychologist is a PhD. So they're a PhD psychologist, and their job is to understand cognitive problems and psychological issues. And so things like depression and anxiety, and also things like aphasia or memory loss. And then they can help make recommendations about the diagnosis or treatment for those kinds of issues to the medical doctors. A few neuropsychologists will also offer counseling. So for instance, at our hospital, our neuropsychologists offer counseling for adjustment or grief issues that relate to brain injury, but not every neuropsychologist will do this.
Great, thank you. So it seems like there can be so many doctors and clinicians and specialists on a person's medical team, but is there one person that we can go to that can kind of manage and sum up all the information that's coming to us? I guess who is responsible for synthesizing all this information?
Yeah, I mean, this is a big problem with our healthcare system, frankly, and a lot of patients, a lot of people struggle with this. So ideally, the person who sort of is the quarterback of your team, of your medical team, is your primary care doctor, ideally. So that could be a family doctor or your internist, for example. Now, sometimes if, say you had a stroke and your main medical problem is that you had a stroke and you're trying to recover from your stroke and you don't have a lot of other medical problems, well then maybe your physical medicine doctor is the right person to serve that role. And that's because that's the person you're going to see the most often, and most of the other issues that you might have center around the stroke. And so sometimes a physical medicine doctor or a neurologist for instance, I know we had some questions about primary progressive aphasia. So maybe your neurologist is your main doctor for the primary progressive aphasia, and that person can serve in that role. Now, the key to this, though, is that you have to, not every doctor is willing to do this if they're not a primary care doctor. And so you have to ask. So if you have a doctor that you like, who you think is like your main doctor, then you can be upfront and ask them and say, I'm really struggling because there's a lot of different people and nobody's talking to each other. And so can you be the quarterback of my team and be the person who coordinates? And some doctors will say yes. And hopefully if a doctor really can't do it, they'll say no, so that you know that that's not an option. So that's the best advice I can give, I think, on that.
Thank you. For those with severe aphasia, do you recommend a mental health counselor, social worker, or psychologist, even though it's difficult to communicate? Like, how can we work with clinicians if there's difficulty in communication?
Yeah, this is tricky. So first thing to say is issues like depression are very, very common when you have a neurologic disease or disorder. In stroke, it's about 50% of people end up with clinical depression at some point after stroke. So I think the first thing I want to say about this is care for those issues is very important. And I try to get as many people as I can into some kind of counseling who have those issues. Now, it can be really hard when you have severe aphasia because you participate and communicate with the person doing the counselor. So you need to talk to the person who's doing the counseling about what they can handle. Not everyone is familiar with this. Ideally, if you can go through a rehabilitation hospital and find somebody like a neuropsychologist who's used to working with people with aphasia, they'll be able to handle more. The other thing that you can sometimes do is do sort of couples or family therapy with both a spouse or a caregiver and the person with aphasia in order to facilitate the communication. And the key there is talking to the therapist, the counselor, to see what they're willing to do.
With therapy, what can a person do if their therapist suggests that they stop therapy, even though there's still that motivation from the person with aphasia to see the therapist?
Okay, we're talking about speech therapy now, I think, for aphasia, right? So yeah, this is a common thing. So so I guess a couple of things to say about this. So a speech therapist wants to help you, and they want to make sure that you're making progress. And sometimes speech therapists feel like they're not making progress anymore. And sometimes they just run out of ideas or they get burnt out. And so sometimes if you feel like you're making progress and the speech therapist says, I've run out of things to do, then it can be helpful to find a new therapist. And you can talk to your doctor about getting a new prescription for therapy. You can also sometimes talk to the therapist and say, well, do you have any colleagues that you might recommend who might be willing to take me on? So that's worth a try. Now, sometimes you may have a few therapists who say this to you, in which case it may be time to take a step back, take a break, and then try to start up after a little break to see if there's more that you can do, or to find an alternative place to get therapy, which I think we're probably gonna touch on in a bit.
Yes. So we have a question in our Q&A chat. Why does the stroke patient sleep so much? How many hours is typical?
Yeah, this is a great question. So very, very common for people who have had a stroke to need more sleep. And to run out of energy, sort of usually in the middle of the day or in the afternoon. It's common. One thing to say is that if you haven't had a sleep study, it may be worth asking your doctor if that's a good idea, because I mentioned sleep apnea before, and sleep apnea is very common, and it can cause a lot of sleepiness and a need for more sleep. But even people who have a stroke who don't have sleep apnea will often need more sleep. There's no right number for everyone. So everyone who hasn't or has had a stroke needs a little bit different amount of sleep to get by, and you can expect it to be more after the stroke, but there's no right number for everyone.
Thank you so much. We had a few other questions, but we have very similar questions coming up a little bit later. So I am going to move on to the brain. Can we talk a little bit about the brain?
Yeah. Actually, Jen, before you do that, can I just ask for a bit of feedback about the whiteboard? If people can say in the Q&A whether they want me to use the whiteboard or whether they'd rather me just have my face up here, that would be helpful feedback for me. Okay, go ahead, Jen.
So can you talk a bit about brain cell damage, specifically whether damaged brain cells can recover?
Okay, I'm going to put the whiteboard back up because we have two responses that say, yes, use the whiteboard. Okay, so the question was, can brain cells recover? So the answer to this is that if you have a stroke and the brain cell dies, your brain, that cell can't come back, and your brain doesn't really make a lot of new cells. So what does happen though is that some brain cells don't work after the stroke, but they're still there, and those cells can come back. So they can start working again, and sometimes it can take months to get those brain cells working again. And then brain cells can form new connections, and we think that sometimes they can take on new roles that they didn't have before. And so and so that's really what's going on as you're recovering. It's not brain cells growing back, it's forming new connections, cells that are stunned coming back to life. Yeah. I see the message from Steve here. So Steve says, isn't it helpful to encourage people with aphasia to be more active in their daily lives, interacting, communicating with other people? And yes, 100%, Steve. And I should have said this before. When I see a patient in clinic, a lot of what I do is coaching about living with aphasia. And I probably should have gone through my sort of standard coaching with everybody. So let me do that now. So the main things that I talk about with people with aphasia are three sort of lifestyle things. The first one is social activity. So I think it's really important for people with aphasia to engage with the world. And it's very tempting to withdraw. But it's really good to resist that urge and try to engage with people and ask people to be patient if you need to. But to communicate with all different kinds of people, it's really good for your brain to be socially active, and it's challenging for people with aphasia to communicate with lots of different types of people. So it's really good therapy too. Okay, so social activity is the first sort of lifestyle recommendation. The second one is physical activity. So we know that physical activity is good for your brain. Now, physical activity, I think people know, has heart benefits, cardiovascular benefits if you're a doctor, but we also think it's good for your brain in a separate way. We don't understand completely why, but physical activity is good for your brain. And this is whatever you like to do. So, you like and can do, let's say, whatever you like to do and can do. So it can be walking, it can be swimming, it can be gardening, it can be biking, it can be dancing. Dancing is actually, I think, a really great activity if you can do it, because it's both social and physical. Okay, so physical activity is the second one. And the third one is, let's call it mental activity. And so this is more or less not sitting in front of your TV to the degree that you can help it, and doing things that are mentally stimulating. So these are things like games, puzzles, of course, therapy, and things like that. And the more that you can incorporate these three things into your life, I think the happier and better off you'll be with your recovery. This is not just from a sort of life perspective, but from a brain perspective also, we know that these three things are good for your brain. So really, thank you very much, Steve, for prompting this.
And actually, while we're on this topic, Thomas mentioned social activities can help avoid learned non-use, correct?
Yes, 100%, yes. So part of what we're trying to do is here with these three things is avoid learned non-use. Okay, so what learned non-use means is it's sort of like the use it or lose it idea. And so the more you use your abilities, the more you keep and gain abilities. Practice makes perfect, let's say. Okay, so that's, yes, absolutely.
So we have a few questions about stroke. What are some common sensations that people feel after a stroke? For example, one of our audience members wrote in about a tingling sensation in the head and wants to know if that's common after a stroke and why something like that might happen.
Yeah, okay, so so the answer is everybody's different, and there's lots of things that people can feel after strokes. A tingling sensation in the head is not a common one, I would say, but I have heard that one before, and it's a little hard to answer why, because there's potentially a lot of reasons why. So I think some common things that people talk about are headaches, sleepiness. Usually if there's tingling or numbness, it'll be on one side. Sometimes people develop pain on one side. There's lots of different things. It's a little hard to go through everything, but everybody's different, and you can talk to your doctor hopefully about these things to try to figure out why.
Thank you. Can you give us some insight into inner speech? You're definitely the expert on this this subject, because we received questions about this feeling of a loss of connection between the brain and the mouth and being able to say the right words at the right time. Some of our audience members want to know if this is a permanent condition and if you have any suggestions.
Yeah, I feel like this question maybe was planted so my lab does some research on inner speech in people with aphasia. So the observation here, a lot of people with aphasia will say something like, I can say it in my head, right? And then you try to say it out loud. You feel like you can say the word inside your head. Maybe there's a voice inside your head that says a word correctly, and you try to say it out loud and it doesn't come out the right way. So now we all have inner speech, right? So we can all we all talk to ourselves in our heads. So what we are concerned about here is this issue where it's in your head, but you can't get it out. And so what we think is that might tell us something about the kind of level of problem that a person has, that they can retrieve, or let's say find, the sound of the word, but you can't make your mouth move the right way to say it. And our hope is that we can understand the best ways to treat a person depending on whether they have a lot of inner speech or not. Now, I know it's frustrating to a lot of people that you feel like it's in your head and it can't come out the right way. Our perspective, my perspective on it is it's an ability that you have. It's an ability to say it in your head, and it's frustrating that you can't get it out. But I hope that it at some point will give therapists something to work on. It's a step farther than some other people can get. So I hope that was a good enough answer.
It is great, thank you. Can we talk a little bit about recovery and therapy? Specifically, why do some people find that singing words is a lot easier than speaking them?
Yeah, so it turns out that singing and speaking rely on different parts of the brain. So we think singing is involves more of the right hemisphere. And other things like some kinds of automatic speech or cursing sometimes rely on the right hemisphere more. And so these things are a little bit spared. So, so these things can sometimes be easier for people. And there's some kinds of therapy that use this as a tool to try to support speech. Now, there's a lot we don't know about this. So there's debates right now about how much of this has to do with melody and how much of it has to do with rhythm. These are actually two different things, and they work a little bit differently in your brain. And so I hope there's going to be more research coming out in the next few years that will help us understand sort of what the secret sauce is in singing, so that we can use it more effectively to help people speak better.
Great. Is there a general time frame for speech recovery? What can we sort of expect in speech recovery?
Yeah, okay. Yeah, this is an important question. So the answer, and I'm talking about stroke here specifically. This may apply to traumatic brain injury a little bit too, but the timelines are a little bit different. But okay, so the rules of thumb are that improvement is fastest early. So we're talking weeks to months. When I say early, I mean weeks to months here. So first, let's say 3 months or so. And then improvement gradually slows down. Okay, now some of you may have been the victim of a myth, a terrible myth promulgated by neurologists that says recovery stops at some point. So neurologists seem to think that recovery stops after, say, 12 months or so, after a year. And that's just not true. Okay, so that's a myth. Recovery stops after a year. If a neurologist ever said that to you, I apologize on behalf of my colleagues. So I would say that recovery continues forever. But what is true is after the first year or so, the most common thing is slow, steady improvement with therapy and practice. Okay, so I'll give you an example. We have a gentleman who's been coming back to our research lab for research studies for 8 years, and his speech is so much better now than it was when we first saw him. I don't even know how long away from his stroke is, but it's been a long time. So people never stop recovering, but it's slow, steady progress after the first year. Okay, hope that's good.
Yes, we received so many questions that were kind of along the lines of, I've had aphasia for a year or more. So what can I do now? So it sounds like some of our audience members feel a bit stuck in their progress. But now we have Dr. Turkeltaub, the Mythbuster.
Right, yeah. So, okay, so it is true, it can be frustrating after a long time because the progress is slow. And it takes hard work. And everyone is different. So a couple of things to say. If you're trying, it's not your fault, is the first thing to say. This is how recovery works. And so it takes hard work and it's slow. But I think most people can get better slowly and steadily with the hard work. Okay, so things that you can do, we started to talk about before. Staying active is really important. We talked about that before. Continuing in therapy if you can, or practice. If you don't have formal therapy, I think is important. Practice doesn't have to be torture. Practice can be social activity, games, other things like that. Conversation groups are great. And then Jen, I don't know, are we gonna talk about other places to get therapy and stuff like that?
We do have a few more questions on that coming up.
So I'll wait for that.
Sure.
I'll also, I'm gonna just put out a plug here for research studies. So, and I know I'm focused on this because this is what I do, but I'll say this, we need your help to understand aphasia better and to help other people improve. And in our experience, we find it to be a really good activity for people with aphasia. It's stimulating, and usually you get to work with interesting people and do something you haven't done before. So I'll put a plug in for that also here.
Actually, while we were talking about your lab, there seems to be so many differences in recovery from person to person. Do you maybe want to talk a little bit about build?
Yeah, it's another plant question. So, okay, so I'm going to call this individual differences. So this is the word that that doctors and scientists use to say that everyone is different. So every person with aphasia comes into their stroke or their other cause of aphasia as a different person. Every stroke or injury is different. And even people who have very similar brain injuries can have different recoveries because our brains all work differently. So one of the key challenges in treating aphasia is that everyone is different. And so we're doing a research study called BUILD, which stands for Brain-Based Understanding of Individual Language Differences After Stroke. And the idea here is to try to understand why some people do much better than we expect after a stroke, and some people don't do as well as we would have hoped after the stroke. And the idea is that if we can figure out why in the brain, then maybe we can develop new treatments to help people recover better. So this is in Washington, D.C., where we work, and we do very detailed testing for speech, language, thinking, reading, lots of things. And then we do brain imaging to look at structure, activity, connections, and then we try to figure out why some people are doing better than we would have expected and other people aren't. So that's the BUILD study. There's lots of researchers around the country who are doing different studies sort of like this. This is the main one we're doing right now. And the goal eventually is to try to get better treatment so we can make a bigger difference for people with aphasia. Thanks for that question.
I've just put the link to Dr. Turkeltaub's lab in the chat, and I'll also be putting it up on our screen a little bit later. Let me just see here. So we've just talked a little bit about differences in recovery from person to person, but is there also great differences in recovery within the same person? So for example, one of our audience members asked about a situation where this person had a stroke many years ago, and then in an unrelated incident, went to the hospital and this person's speech drastically improved. A few weeks later, there was a dip again. Do you often see this type of spike in improvement? And do you have any idea of what could cause it? Could it potentially be hydration from an IV?
Yeah, so, right. So a very common thing that we hear from people is ups and downs. So I'm gonna approach this question from that standpoint. So a lot of people say it's not, every day is different or different from morning to night. And we don't completely understand why this is. So we call this fluctuations. We don't totally understand why this is. Sometimes there may be an identifiable cause like an infection, or you mentioned dehydration, and that's sometimes the case, but very often people have ups and downs and we don't totally understand it. If it's a dramatic change, then you need to go to a hospital and try to figure out what's going on. But everybody has sort of ups and downs. Now, in this particular case, yeah, I mean, it may be that there was something like dehydration that was going on, and once you fix that problem, everything gets better. I have a message from Darlene that I want to address here because I forgot to mention this about research. So I plugged my own research and I mentioned obliquely that there's other research going on, but I do want to mention that that aphasia.org, the National Aphasia Association, is working on helping people connect with research. So over the next couple of months, you can expect a couple of things. We're working on putting more information about research on the website. So studies, for instance, where researchers can post studies that people with aphasia might be interested in. And we're also working on a grant program. So the idea here is that there are no organizations in the United States that give grant funding specifically for aphasia research. And so the NAA is going to be the first, and the goal is to offer seed grants to researchers for projects that we think can make a meaningful impact for people with aphasia. So we're working on getting that started hopefully later this year. So thanks, Darlene, for asking me. And so there's the plug for the NAA.
Thank you so much. Let's go into the Q&A chat. I have a few questions.
Okay.
Have you seen a lot of patients that have severe migraines after their brain injury or stroke?
Yeah, this is interesting. So, okay, migraines is the question. So I have seen some people who develop migraines after stroke. It's not common, but I have seen it a couple of times. And it's important to depending on the situation, it's important to find out why. So sometimes there's not an answer to this, but you want to make sure that there's no new problem in the brain. It's usually not the case that there's a new problem in the brain, but you want to confirm that there's no new problem in the brain. Now, I will also say I have sometimes, I've had a couple of people where the migraines actually get better after stroke or even go away. And so there's a lot that we don't understand about the brain, and I think this is one of those things that we don't understand, but I have seen it a couple of times before. Okay, not sure what else to say about that.
That was great, thank you. We have a question related to singing again. If singing works so well, then can a person with aphasia sing what they want to say?
Yeah, good question. So I'll say this, singing works for some people. It doesn't work for everybody with aphasia. It tends to be people who are, I'm going to use a medical term here, non-fluent. And so those are people who have effortful speech, hard to make sentences, often motor speech problems. So these tend to be the people who struggle with these kinds of things, who have sort of halting speech, tend to be the ones who where singing can help. It's not magic in that like it can't help you just say anything that you want, and there's some debate about how much it can help. But for these people, it can be helpful to help them sort of carry words that they need to get out. It takes training, though. Okay, I hope that was useful. So I also want to mention that I think the plan is for this Ask the Expert kind of session to be a regular thing for NAA, and I'm sure that we're going to have speech therapists do these also, who can maybe answer some questions about therapy, about speech therapy with more expertise than I can. So don't be afraid to ask these kinds of questions again when we have a speech therapist here.
Great advice, thank you. Let's see, let's move on to primary progressive aphasia because we're getting loads of questions about it. Do you want to start off with a summary of what it is?
Okay, so primary progressive aphasia, primary progressive aphasia is a diagnosis that describes a person who has gradual onset of aphasia, so gradual problems with speech and language, and where we can't find no cause like a stroke or a tumor or an infection, where we can't find something like that that's causing the gradual aphasia. And when we see that pattern, then we call it primary progressive aphasia. So it's primary progressive aphasia. I think this is sometimes confusing for people as a description. It's a description of a person who has this sort of problem. Okay, so now the cause is a neurodegenerative disorder. So neurodegeneration is caused by toxic proteins in brain cells. And there's different kinds that can cause primary progressive aphasia. And it's hard to tell which kind it is at first. So when we see a person who has gradual aphasia, and that's the main thing, we call it primary progressive aphasia. These people will often have other problems too. So sometimes memory is an issue, sometimes inhibition is a problem, sometimes attention is a problem also. Sometimes there's physical problems, sort of like Parkinson's, like problems. So one thing I think that's confusing for people is that aphasia isn't the only problem that people with primary progressive aphasia have. Sometimes they have other issues also, and that's because the cause is neurodegeneration. I hope this is making sense. I think we'll probably do another one of these sessions specifically on PPA, so we can do more detail on this. Okay, but that's PPA. It's a description of a person who has gradual aphasia and is caused by an underlying neurodegenerative disease. Okay.
Would you be able to go over maybe the time frame or stages that a person could expect with PPA?
It's tricky. So it's different from person to person. And so I don't want to give one answer to this, but usually the progression is over years. Depending on the type, there's a few different types of PPA. The progression can be many, many years, or it can go faster in some people. And some people have only aphasia for a long time, and other people quickly have other problems. So, yeah.
We have a lot of questions about treatment for PPA and related to medication. So is PPA treatable with medication, and who would we speak to about this? Who on our medical team should we speak to about this?
Okay, so there's no medications that treat the neurodegeneration. So what I mean by that is no medicines that fix PPA. So, but there are sometimes medicines that we can use for symptoms. And so depending on the exact symptoms, there are sometimes medicines that can be used. I hesitate to go through specific medicines here because there's several for specific problems. But sometimes there are, and usually the best kind of person to see for this is a neurologist. Ideally, if you can find a cognitive or behavioral neurologist. They're the ones who have the most expertise in PPA. People who are listening with PPA, I know it's frustrating that a lot of neurologists don't know enough about this problem. Believe it or not, PPA was only discovered 20 or 30 years ago. It was only named about that long ago. And so it's a newly recognized problem that a lot of neurologists don't know a lot about right now. But if you can get in to see a cognitive behavioral neurologist, they should know more.
Great, thank you so much. Another question that we get quite often was about people with aphasia who may not recognize that they're having difficulties with speech. It seems like it's especially difficult for their family and friends who really want to help or get them help with neurologists and doctors and therapists. Do you have any advice on that?
Yeah, okay. Yes, so so I got to preview the questions before and I saw that this was a theme. And I think a lot of this people were asking specifically about PPA, but I'll say that this can happen in any cause of aphasia. So what we're talking about is people who don't recognize that they have a problem. And the first thing I want to say is I want to give you the term for this because this is like a secret key that can open up information. Uh, so this is the term for this problem, anosognosia, and it means lack of recognition of your problems. And it can happen in neurodegenerative disorders or traumatic brain injury or stroke or mental illness also. Now I happen for PPA specifically, I was looking on the internet before, and there's a good article on this at one of our sister organizations, the AFTD.org has a nice article about anosognosia. So you could search for it there. It's really challenging because a person who doesn't recognize they have a problem, it can be very hard to get them invested in their own treatment. It can be hard to get them to see doctors or therapists. And so you'll see some of the recommendations if you go look up this this article at the aftd.org. But the first thing I want to say is it's not their fault. They're not just being stubborn or pig-headed. It's because of the brain injury or the disease that they have. And so I know it's hard, but it requires patience and compassion and reinforcement over time of information. Yeah, but it's a very difficult problem, I think. So I'm going to refer you out to this other information source for more detail on this. Okay.
Thank you so much. I've also put the term anosognosia in the chat for anyone who wants to copy and paste it, as well as the aftd.org. Dr. Turkeltaub, in what ways can diets like the MIND diet help a person with aphasia, and what vitamins, or are there vitamins that can help with brain health?
Yeah, okay, good question. So I get this one a lot. So, so the answer is really, we don't know for sure on this. So, so the main recommendation is a healthy diet. So, so for most people, this is like a heart health diet, like a Mediterranean diet, lots of fruits and vegetables, healthy fats like fish, things like that. So these are the sort of standard things. Now, there's a lot of people that sell supplements or vitamins, and we don't have any evidence that those things help. Now, sometimes, very often, they're not going to cause problems for you, but we don't have great evidence that that supplements or vitamins can help with aphasia recovery specifically, or stroke recovery.
Great, and we are just about out of time. It went by fast.
Super fast.
Yeah, okay. I wanted to thank everyone for their questions. In our final moments, I wanted to talk a little bit more about the Cognitive Recovery Lab, just because you've been quoted talking about what a special opportunity participating in research can be. And I thought it was such a great perspective. So can you share a little bit about that with our audience today?
Okay, sure. So, so I run a lab called the Cognitive Recovery Lab. Let me end my screen share here. Actually, let me put that back up. So, 1 second, sorry. Oops, who can share this? Okay. Okay, so yeah, so my lab is called the Cognitive Recovery Lab. Our whole goal is to help people with aphasia, and we focus on brain basis of language, recovery, and developing new treatments. We're in Washington, D.C. at Georgetown University. So I'll invite you to come look at our website, cognitiverecoverylab.com, to see what we do. I'll also point out that there's a lot of great researchers around the country who are doing work on aphasia. In a few months, you'll be able to look at aphasia.org. You can already look at aphasia.org under the affiliates. And there are studies and researchers listed on aphasia.org already, and we're going to expand this out in the future. And if you're looking for other research studies, you can also look at clinicaltrials.gov. Is a sort of website that has a lot of different research studies from around the country, and you can search for aphasia or stroke or primary progressive aphasia, for instance. As a general plug for research, I like to do this with people. I'll say that you have a lot to contribute. So our goal is to help people with aphasia, and we can only do that with your help. And you have a special ability to help us because of your aphasia. You're the only people who can help us, and so it's a really valuable service to participate in research, whether it's our labs or somebody else. It's a really good service to society, and it's something new that you can offer because of your aphasia. And so I think it's important that you recognize that, and that if you're able to, that you help us. We've found that most people find it to be a very rewarding experience, and so I hope you'll consider participating in research either with us or with somebody else if you can.
I really love that. Thank you so much. I want to thank you, Dr. Turkeltaub, for sharing your time with us today. It's been really wonderful. I really appreciate how good of a friend you've been to this community and the time that you've shared with us. Again, let me see if I can share my screen real quick.
I could just turn mine off, I think, yeah.
Thank you. For more information on aphasia, to find the recordings from today's webinar, and for more information on future events, please visit us at aphasia.org. We have loads of great resources there, and we are currently working on a schedule of online groups that meet through Zoom. These groups are open to people with aphasia, families, clinicians. We want to be supportive. It's an aphasia-friendly space. We're planning to have conversation groups, book clubs, workout sessions, and we already have some really great online meetups going on, so definitely check that out. You can find that on aphasia.org/online-events. Our next Ask the Expert will be in about a month, so stay up to date with Ask the Expert news by visiting us at www.org/ask-the-expert-webinars. And finally, if you have any comments, questions, or suggestions, or if you just want to say hi, you can always email me at jen@aphasia.org. I'll be putting those in the chat shortly. Let me see. I think someone was raising their hand. I actually can't find it. I saw that Jane was raising her hand, but now I'm not able to find your comment. So I'm very sorry that I'm missing that. But I'd like to say a final word, because I would like to say thank you to all of you for sending your great questions for today's Ask the Expert, and for spending some time with us. I sure hope to see you at the next one. Thank you and take care.
Yeah, thanks everyone. This was fun. I hope it was helpful.